Hi, welcome back to another episode of Talk Sex with Dr. S. Before we start, I'd have like to say something to you all.
Well, we have a lot of really good questions, I think, that have been coming from all of you, so we wanted to encourage you to keep sending those. And then I think the other thing that Jonathan and I wanted to say is that this is a work in progress, so we're really glad that you're back. As you can see, we're shooting from another lovely location somewhere on the St. Louis campus. This could be changing every week, we don't know. But we have a couple segments that we want to try this week, and we'd love your feedback as well.
So you're going to be seeing the proper way to put on a condom today, as well as it's going to be a small sex quiz. But now to get to your questions, because we know that's why you're here. Dr. S, how many orgasms can a man have in a day?
I really like this question. Problem is we don't have a really good answer for it. We do have some studies that have examined the highest frequency of orgasm possible in a male, and it's done within a 1 hour period. And the record is 16 orgasms from a male within a 1 hour period.
16?
Yeah, 16.
In an hour.
But you have to remember, this is a world record, Jonathan. It's a world record.
The world record for women?
Yeah, 134. Women don't have a refractory period, so they are able to, start again.
16 and 134. Do vibrators kill nerve endings, making you less sensitive?
Okay, the use of vibrators, male, female, doesn't matter, does not kill nerve endings. It does, however, temporarily make them just a little bit numb. So just as you, if you all have ever put on a wool sweater at the beginning of the day and you feel like, I can't possibly wear this all day, it's scratchy. What happens is, when you first put on the wool sweater, the nerve cells in your skin fire because it's something unfamiliar. And then after a while they habituate, so they stop firing because it's not an emergency. When you use a vibrator, it's moving those skin cells really rapidly, and that can cause some numbness, but that numbness goes away, and it certainly doesn't cause any lasting damage.
Okay. How can you solve the problem of premature ejaculation?
Okay, this is a great question. Not entirely sure the age of our viewing audience yet, but this is the chief complaint for men under the age of 40. And there are several things that can be done for premature ejaculation. Some of them are extremely, extremely effective. There are some medicines on the market that can help you out with it, but and you can also have cognitive behavioral therapy, which involves meeting with a trained therapist, and you write down patterns of thought that lead to premature ejaculation, and then you engage in substituting other thoughts. So that's therapy that can be done with a trained therapist.
Okay, so anything that you can do yourself without the use of a psychologist?
Yes. One of the things you can do, actually, forgive this line, but will you hand me that penis? Thank you. We have this little model here. This is a wooden model of a penis, and there are 2 techniques that you can use in order to ward off premature ejaculation. And actually, this is one of the most successful therapies in psychology, in that we can help you successfully cure, which we rarely use that word, but premature ejaculation within about between 2 and 10 weeks of practicing these techniques. One is called the squeeze technique, and one is called the start and stop technique. So what it involves is stimulation of the penis by the partner, and that can either take place through intercourse, it can take place manually, orally, it doesn't matter. So the penis is stimulated by the partner, and the male has to tell their partner when they reach a point called ejaculatory inevitability. So that means the point at which you know that orgasm is going to happen and you're not really sure that you can stop it. Then you have a code word with your partner, so you say, whatever, Barbados. And then when you get to the point of ejaculatory inevitability, you say that word to your partner, and then, and this next part is going to seem kind of archaic, but with the squeeze technique, you just grab onto the tip of the penis, the partner does, and squeeze as hard as is able to be tolerated by.
That seems painful.
Well, actually, it could be painful, but that's where communication comes into play. It has to be force enough to stop the ejaculation, but it can't be painful enough to inhibit erection. Otherwise, you're not going to help the situation out at all.
The only thing that I'm wondering is, could that cause retrograde ejaculation?
It shouldn't, no, it shouldn't. Really, retrograde ejaculation has more to do with the dysfunction of a valve that blocks it from going back into the bladder, but that's a great question. And in fact, I'm glad you asked it, because we could have that question after this if you hadn't asked it just now. So that's a great point, but that's more of a valve issue. So you grab, you squeeze as hard as you can until the ejaculatory inevitability goes away or subsides. And again, the partner has to communicate that to the other person. You can do this by yourself, but it's actually much more effective with a partner because much of premature ejaculation has to do with anxiety or extreme excitement with that partner. And you're much more able to control those things with masturbation. So you squeeze until it subsides, you let go. And the real procedure involves doing that several times. That's where they take it from calling it squeeze to stop and start. So you do this several times, 3 or 4 times during one sexual interaction until you allow the male to ejaculate. And that'll actually help them control it just a little bit.
Okay, the only question that I have then is what happens if the male is able to ejaculate before even the manual pleasure is admitted?
If it's that premature in ejaculation, then they need to start this with masturbation.
Okay.
Okay, so if it's such that immediately upon interaction with a partner they ejaculate, then they need to start this by themselves, alone. And the other thing I wanted to tell you that I forgot to mention, Jonathan, is you can grab here and you can grab on the underside of the penis and the top side of the penis, or you can grab at the base and squeeze really hard. So you have to, again, communicate with the owner and ask the owner what's most comfortable for them, keeping in mind that neither of them is going to be completely comfortable because you're squeezing their penis when they're wanting to ejaculate. So these are really, really effective therapies, though.